Good morning. Is this the clicker?
I think so.
It is, okay. All right. Well, it's a pleasure to be with you today and talk about something near and dear to my heart, which is brain health and how it can positively affect the lives of our employees and also the productivity of our organizations. So how in the world would a county government get into working with brain health? It seems something that's not very likely. Well, it all started with the Great Recession when, like all of you, we were faced with dire circumstances. I mean, we had to cut about $14 million out of the Ottawa County budget just to balance. And so one of the things we looked at was health, because our health costs were skyrocketing. And we successfully implemented a high deductible plan with a very ambitious wellness program, and basically required employees and spouses to do biometrics every year, which was really, really popular when we first rolled that out. But they could choose the plan, or they could stick with the other two offerings. Ultimately, we had 97% choose the high deductible plan. Industry average was 68%, so it went pretty well. So what happened? It resulted in healthier employees and spouses. It lowered claims, and that's the big thing. What I realized was I had been doing this a long, long time, longer than I care to admit, and I was focused in a great left-brain fashion on how do I get employees to pay more? How do we reduce the benefits? Exact wrong approach. The right approach is to reduce claims costs. Well, how do you reduce claims costs? People get healthier. So you focus on the top diseases that cause the highest amount of costs in your plan, and we had amazing results in Ottawa with that. So we saved $5 million second year out of an almost $11 million healthcare benefit spend. And when I left to come back to Kent in August of 2021, our savings had been at about $15 million between 2011 and 2021, so pretty significant. And healthier employees. That's the main goal. If you focus on the right thing, the things we really wanted came in spades, better than we ever could have done. Okay, so one day I'm in my office, and the sheriff and undersheriff came in, Sheriff Kemper and Undersheriff Weiss, and they told me about the Protect the Protectors program that Robertson Health had, and a way to measure brain chemistry against a range that Dr. Robertson basically created, and make modifications to your diet or using supplements in a way that can make your brain healthier. And so we did. We started with the sheriff command staff and a few from the administrator's office and department heads. And ultimately, the program was expanded to the whole sheriff's office. And then during COVID, with a huge impact on some of our workers that were hit the most with their interactions with a very angry public, health, mental health, juvenile, corrections, we expanded it to those areas. And again, high percentages of folks signed up. We didn't make it mandatory, it's voluntary. And we actually had an 86% return rate in the sheriff's office. 86% of those who went through year one wanted year two, and after year two wanted year three. Professional and personal stressors were substantially reduced. Financial risk projection for heart disease, heart event, obesity, and diabetes all went down significantly. Huge, huge savings to our plan by not having those claims. The average lifetime financial risk projection for those who participated, and Doc can correct me on numbers, but I think it was about, at that point, 240 to 300, was 120,000 to 62,000, average savings of $57,488 per employee. So the numbers I saw were about $49 million for that number of employees over the rest of their careers. So the predictive analytics that Doc wrote measured it from where every employee was to the end of their career if they followed the brain health regimen. And so I remember telling my staff, what if he's only half right? We saved $25 million. And so, let's see. So then I moved from Ottawa to Kent. And Kent had also participated in the Protect the Protectors program. A whole lot of police agencies did in West Michigan, not sure about other areas. And then we've extended this program to our department heads, the health department, and now we just went out about a month ago to ask any employee if they wanted to sign up for the program. So currently we're in discussions with our health benefit provider. I would love to get this to be a covered benefit in the health insurance. It might have to be more of a prevention benefit that's covered, but that way I can pretty much extend it to all employees and not have to hit the general fund for it. So that would be a really good thing.